Hi everyone, my name is Kayla and today I'm going to be presenting on rabies. So what is rabies? Rabies is a zoonotic viral disease that spreads to people and pets through either bites, scratches, or mucosal contact from infected animals. It can infect the central nervous system, especially the brain, and what makes rabies really dangerous is that it's nearly 100% fatal when symptoms begin to appear. However, it is completely preventable with vaccination. So a little background on rabies is that rabies has actually been recognized since around the 1930s, I think 1930 BCE, and it's been long associated with fatal infections following animal bites. And before vaccines, people kind of use crazy or not crazy, ineffective and extreme methods like burning wounds or even amputations. And the first vaccine was developed in 1885 by Louis Pasteur, who successfully treated a boy who was bitten multiple times by a rabid dog. But before he had treated the little boy, Pasteur actually was experimenting on, I think it was about 50 dogs in his lab, and he inoculated them with dried spinal cords from infected rabbits. And this kind of became like the early basis of early vaccines, specifically for rabies. But before this breakthrough, rabies was almost always fatal. But early vaccines used his method, so like the nerve tissue in the vaccines, and it had high safety risk. So eventually modern vaccines developed over time, specifically around the 1960s and the 1980s, and now we're using cell culture techniques. So this makes it much more safer and effective. So the official name for the rabies vaccine is rabies vaccine. It's marketed under two types of vaccines. Two types of vaccines. So it's going to be MVAX, Emovax, rabies, and RabAvert. And unlike many childhood vaccines that we were given, the rabies vaccine is actually not combined, and it's given on its own. But it can be both used for pre-exposure and post-exposure prophylaxis. And what prophylaxis is, it just refers to preventing disease, and we'll talk about this a little bit later on. But this is what makes rabies so unique, that it can be prevented even after exposure through vaccination. So, rabies vaccine is classified as an inactivated or killed whole virus vaccine. And what this really means is that it contains the entire rabies virus, but it's been chemically inactivated, so it can't replicate or cause disease. And the virus belongs to the genus Lyssavirus and the family Rhabdoviridinae family. And it's grown in human diploid cells or chick embryo cells before being inactivated, and it actually uses a chemical, and I think the chemical name for it is called beta-proptolacetone, I believe. And so the immune system primarily recognizes the rabies glycoprotein, and this is what's going to stimulate the production of neutralizing antibodies. So these antibodies are critical because they block the virus from entering our host cells, and in this case it's going to be neurons. So the disease is called rabies, but the name comes from a Latin word meaning rage or madness, but it's also referred to as hydrophobia, and this is one of its most characteristic symptoms. And it's also known as lyssa, which in Greek means violence. As for the infectious agent, it's rabies, which is a virus. It's an RNA virus in the Rhabdoviridae family in the Larissa virus genus, and it's a neurotrophic virus, which basically means it's going to target the nervous system. As for transmission, the mode of transmission of rabies is either going to be through infected saliva and most commonly through animal bites, and this can be an infected animal biting another animal or an infected animal biting a person. And sometimes too, Like if the infected animal bites the animal, it's going to come into contact with the owner. So that's how you see that cycle of transmission going. But the virus is going to enter the body through broken skin or mucous membranes. But actually, this is really interesting, but globally, dogs are the primary source of rabies, but in the US, it's different. It's going to be bats that are the most common source, which makes sense if a lot of Americans or people that live here vaccinate their pets frequently every year, right? As for the pathology, so this is a diagram kind of showing how that works. But so the virus, once it enters the body, right, it's gonna, we'll start here, but the virus is gonna enter the body. It's gonna initially replicate in the muscle cell near the site of the bite for a few days. And then from there, it's actually gonna enter into the peripheral nervous system at the neuromuscular junction. From there, the virus is going to actually, from on the diagram you can see here, but the virus is going to travel through the peripheral nerves and towards the central nervous system using the retrograde axial, I can't talk, that word, transport. Yes, this word, transport. And because it's moving within the neurons, it's actually going to be hard for it to be detected. So that means that the virus is protected from early immune detection. But once it reaches the brain, specifically the brainstem and the cerebellum, it's going to replicate rapidly. So it's going to replicate rapidly, and it's going to cause encephalitis, which is basically brain inflammation or inflammation of the brain. But then it's going to spread outward to different types of tissues like our salivary glands, skin, cornea, and other organs. And then from there, it's going to allow other modes of transmission to other hosts. But this is why it's really important, why our antibodies are really important, because they have to act before the virus reaches the brain. Okay, as for the symptoms, well, let me backtrack. Before they talk about the symptoms, there's actually two different types of rabies that can be present within a person. It's either going to be furious rabies or paralytic rabies. Furious rabies is going to be the most common kind, and paralytic actually occurs, I think it's 20% in cases, so it's not as common. But what you'll begin to see is going to be early flu-like symptoms, so like this can include fever, headache, weakness, and discomfort. But eventually, the disease is going to progress after 2 weeks or so, and then that's where neurological symptoms begin to develop. So this is going to include anxiety, confusion, hallucinations, agitation, and then also excessive salivation, hydrophobia, which is the hallmark symptom, right, and aggressive behavior. But in paralytic rabies, patients mainly, I think they experience muscle weakness and paralysis instead of hyperactivity. So rabies diagnosis is actually very complex, and you can't really rely on one single test. So and these multiple tests are going to include direct fluorescent antibody testing, PCR, immunohistochemistry, serology, and this is all going to depend on the specimen. But most of these are going to be for humans. That can be enough for humans, for us. And so for the vaccine, there are some adverse effects, and most of them are going to be just slightly mild, but they're going to be soreness, redness, or swelling at the site of injection. However, people who do get those booster doses, they may experience some joint pain, fever, or hives, and also too, people can often rarely experience severe allergic reactions, but it is possible. But because the vaccine is inactivated, it can't cause rabies, but also it can't cause it to go back to its original pathogenic form. So there's really no strong scientific evidence that I found that linked rabies to rabies vaccine to immunosuppression, brain developmental damage or changes, or autoimmune diseases. Okay. For the vaccination schedule, this is where I was talking about the pre-exposure prophylaxis. God, I can't talk today. But there's 2 groups, right? So the pre-exposure group is going to be given to high-risk people or high-risk groups. And what this means, it's people that interact with animals or infected animals a lot. So it's going to be your vets, right? People that travel, or even that people that work in lab settings. And they're usually given about 2 doses. And they'll also be given boosters based on antibody titers. As for the post-exposure group, it's going to be given after a bite, so typically after an emergency, right? And this is going to include vaccine and human rabies immunoglobulin. And this is effective because since the virus travels slowly through our peripheral nerves, it's going to give our immune system some time to produce productive and protective antibodies. Okay, so as for the incidence of the disease, rabies causes about 70,000 deaths globally each year, and then 99% of them are actually occurring outside of the U.S. And this makes sense if we're upkeeping our pets and doing, or we're supposed to do in local communities, calling animal control, etc., whenever we see a potential animal with rabies, right? But in the U.S., there are actually fewer than 10 cases per year. And once again, this is due to effective vaccination and post-exposure treatment. But as for prevention, this is going to be our job, right? So we have to at least keep up to date with vaccinating our pets, avoiding any wildlife, so not harming it. But even if it comes close to us, just leave it alone, right? Washing wounds immediately after exposure or possible exposure, and even seeking medical care. Seeking medical care after exposure. But as for the public's not really scared of the rabies vaccine just because it has a high fatality rate. So it's more positive. But the main issue with this vaccine is the fact that not everyone has access to it, and this is specifically to in lower resource regions. There we go. And as for recent events, so there are current global efforts that are focused on wanting to eliminate dog-mediated rabies by 2030. This is going to be the CDC. And then also the main priority here is going to be improving access to vaccines and post-exposure treatment in low-income regions, because this is really where most of the deaths are occurring. And there's also efforts to develop more cost-effective and also longer-lasting vaccines to make prevention more accessible. But lastly, there's also like these large-scale dog vaccination programs that are happening where people are going out of their way and implementing the vaccine to the dogs. And the reason for that is because 99% of rabies is caused by dogs. So this is trying to reduce that number. But that is everything. Thank y'all.